Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and the Honourable Dorothy Shepherd, Minister of Health. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le Dr. Jennifer Russell, et l'Honorable Dorothy Shepherd, Ministre de la Santé. Est-ce que tout le monde a désactivé le son de vos micros? Please make sure you have muted your microphones.
I can hear the echo.
Can everybody please mute your microphones? Voulez-vous assurer de désactiver le son de vos micros, s'il vous plaît? Dr. Russell.
You sure everybody's muted then? You can still hear a little bit of... Somebody's not muted. Yeah.
Gilles, on peut t'attendre. Peux-tu fermer ton micro, s'il vous plaît? Merci. Dr. Russell.
Thank you very much. Merci, Bruce. Good afternoon. Bonjour à toutes et à tous.
Today, I will be reporting on the new outbreak of COVID-19 at the Edmundston Regional Hospital in Zone 4 and updated advice on wearing masks outdoors, at drive-through restaurants, and in schools. Before I begin my report, it is my sad duty to inform you that another New Brunswicker has died from COVID-19. An individual aged 60 to 69 years in Zone 4, which is the Edmundston area, passed away today. This is the 8th death we have seen since the pandemic began. This reminds us, once again, that behind the numbers and the statistics we cite at these briefings are people. Fellow New Brunswickers who enjoyed life and love with family and friends who cherished them. I want to offer my most heartfelt sympathy to the family and loved ones of the deceased. Please know that we all share in your grief.
To begin my report, it is my sad duty to inform you that another New Brunswicker has died of COVID-19. An individual aged 60 to 69 years old in Zone 4, which is the Edmundston area, passed away today. This is the 8th death we have seen since the pandemic began from COVID-19. This reminds us once again that behind the numbers and the statistics that we cite at these briefings, there are people, fellow New Brunswickers who enjoyed life and love with family and friends who cherished them. I offer my heartfelt sympathy to the family and loved ones of the deceased. Please know that we all share in the grief you are experiencing. As I have said many times, local outbreaks of COVID-19 are a fact of life in this pandemic and will be for months to come until we have a vaccine and the majority of New Brunswickers are immunized. When outbreaks happen, though, we will move swiftly to slow the spread of the disease and bring the outbreak under control, with your help, of course. That's what we have done in the Campbellton, Moncton, Fredericton, and St. John zones in recent weeks, and these efforts have proven successful. And I do want to acknowledge the ongoing work that so many people are doing for these outbreaks, day in, day out, and especially our regional medical officers of health. Again, they step up every single time in each region. So Dr. Kim Barker, Dr. Yves Leger, Dr. Marianne Paquette, and Dr. Nakoshi Lamptey, as well as our Deputy Chief Medical Officer of Health, Dr. Kristen Muick. Now we have an outbreak in Zone 4, and we are acting with the same resolve to limit its impact. Santé publique a recommandé au cabinet que la zone
Public Health has recommended to the Cabinet that Zone 4 transition back to the orange alert level of our recovery plan. I'm sure everyone had hoped that we could continue to have the entire province at the yellow alert level, particularly with the holiday season now upon us. But the evolving situation in Zone 4 cannot be ignored.
orange alert level are now present in Zone 4. We have seen a rapid increase in the number of cases over the past week, a doubling of case counts within 5 days, and a positivity rate from testing that is well above the provincial average. We also have an outbreak in a vulnerable setting, in this case the Edmundston Regional Hospital. 7 members of the hospital staff have become infected, and at least 24 are currently self-isolating to limit the spread of the virus. This will impede the hospital's ability to respond should there be more cases requiring hospitalization. Cette situation pourrait
This could impede the hospital's ability to respond should there be more cases requiring hospitalization. There is also a significant risk that the virus could spread from the hospital back into the surrounding community.
Moving to the orange alert level, we hope to slow the spread of the virus in the Edmundston area and enable the area's health providers to respond as needed. It is very important that everyone in Zone 4 adhere to public health directives as required under the orange alert level. And I also want to thank the local mayors and representatives and leaders of that zone. We just had a meeting just before I arrived to make sure that they were aware of the situation and trying to give them as much information as possible so that they can help inform residents as well. Wear a mask or face covering whenever you are outside your home, indoors, and outdoors. If everyone joins us in the spirit of urgency, I believe we can limit the scope of this latest outbreak. Aujourd'hui, j'annonce qu'il y a 8
Today, there are 8 new confirmed cases of COVID-19 in New Brunswick. There are 6 new cases in Zone 4, which is the Edmundston region. 1 individual aged 30 to 39, 1 individual aged 40 to 49, 3 individuals aged 50 to 59, and 1 individual aged 60 to 69. These cases are currently under investigation. In Zone 3, which is Fredericton and Central New Brunswick, there is 1 new case in an individual aged 30 to 39. In Zone 6, which is Bathurst and the Acadian Peninsula, there is 1 new case. It is an individual aged 60 to 69. These 2 cases are both related to travel outside the province, and these individuals are currently self-isolating. There are now 78 active cases of COVID-19 in the province. 4 New Brunswickers are currently in hospital, with 3 requiring intensive care.
Today, there are 8 new confirmed cases of COVID-19 in New Brunswick. In Zone 4, which is the Edmundston region, there are 6 new cases. 1 individual aged 30 to 39, 1 individual aged 40 to 49, 3 individuals aged 50 to 59, and 1 individual aged 60 to 69. These cases are currently under investigation. In Zone 3, which is Fredericton and Central New Brunswick, there is 1 new case in an individual aged 30 to 39. In Zone 6, which is the Bathurst region and the Acadian Peninsula, there is 1 new case in an individual aged 60 to 69. These 2 cases are both related to travel outside the province, and these individuals are currently self-isolating. There are now 78 active cases of COVID-19 in the province. 4 New Brunswickers are currently in hospital, with 3 requiring intensive care. Your thoughts and prayers provide comfort to these people and their families, so please continue to think of them as you go through your day. I want to speak to a change in our advice regarding masks outdoors and at drive-through locations. We have determined that the risk of transmission in these circumstances is minimal, particularly when masks are not otherwise required out of doors. Communities at the orange and red alert levels will be required to wear a mask outdoors only in situations where 2 meters of physical distance cannot be maintained. Outdoor public spaces include parks, playgrounds, markets, festival sites, dog parks, and walking trails. Wearing a mask in indoor public spaces continues to be required in all alert levels. In zones at the yellow alert level, there will no longer be a requirement for customers to be masked at a drive-through. Communities at the orange or red alert level would have to use a mask at a drive-through because the directive mandates wearing a mask in any situation, indoors or outdoors, where 2 meters of physical distance cannot be maintained. Dans les zones
In zones at the yellow alert level, there will no longer be a requirement for customers to be masked at drive-thrus. Communities at the orange or red alert level would have to use a mask at a drive-thru because the directive mandates wearing a mask in any situation, indoors or outdoors, where 2 meters of physical distance cannot be maintained.
Our collective experience clearly shows that wearing a mask and keeping physical distance limits the spread of the virus and therefore saves lives, along with all of the other measures, including our border measures, our gathering restrictions, etc. The actions that you take every day to slow the spread of COVID-19 have helped to spare our province from the worst effects of the second wave we are now experiencing. And if we continue to work together, protect ourselves and those around us, I'm confident that we can get through this and hopefully have a safe holiday season and new year. Thank you very much.
Good afternoon, bonjour. Before I begin today, on behalf of all New-Brunswickers, I want to extend sincere condolences to the family and friends of the person who died of complications related to COVID-19. You are in our thoughts and prayers at this very difficult time. Like all of you, we were excited to bring all of New Brunswick back to the yellow alert level yesterday. Unfortunately, due to the rising number of cases in Zone 4, the Edmundston region, we are unable to keep all regions in yellow. On the advice of Public Health, as of midnight tonight, Zone 4, the Edmundston region, will move to the orange alert level. I understand that today's news is not welcome, but it is necessary if we are going to limit the spread of COVID-19. While this is the first time residents of Zone 4 have been in the orange alert level since New Brunswick came out of lockdown, it is in fact the 7th time this has occurred in the province. The good news is that every time we have had to move a zone to orange, we have been able to quickly get the situation under control, and we are confident we will be able to do that in Zone 4. We will achieve this by working together and by following the directives of public health. That means wearing a mask as required, maintaining physical distance, and practicing proper hygiene. This week, some minor changes were made to the directives of what is required under the different recovery levels, and I want to highlight those for everyone. At the orange and red levels, masks have been mandatory in public places, both indoors and outdoors. However, masks are no longer required outdoors, providing that you can maintain 2 meters of distance. Throughout this pandemic, we have made changes as necessary to protect New Brunswickers, and we have done so based on the best information we have available at the time. When the alert levels were first developed, we needed to ensure that we could stop any potential spread of the virus quickly. Requiring residents to wear masks in public, indoors and outdoor spaces at the orange level was an additional measure that we applied. We have since learned that if a person is outdoors and is able to maintain physical distancing, the risk of transmission of the virus is low, and therefore a mask is not required. But if you are in an outdoor space and you aren't sure you will be able to maintain 2 meters of physical distance at all times, please wear a mask. At the orange and red levels, face masks are required when accessing goods through a drive-through window. However, face masks are no longer required when accessing a drive-through in regions at the yellow alert level. This change was made because we have assessed the risk level to be low. And if you're more comfortable wearing a mask at a drive-through, please do so. Every extra additional prevention method you can do is going to benefit you, especially throughout this holiday season. More details on what is required at all alert levels can be found on the coronavirus page on the GNB website. While some things have changed, it is important to know that the self-isolation rules for anyone coming to New Brunswick have not changed and will not be changing before Christmas. Christmas is 2 weeks away from today. If you are not already in New Brunswick and self-isolating, you should not be opening presents with your family on Christmas morning, nor should you be having Christmas dinner with your family on that day. The risk is high. Months ago, we kept COVID-19 out of our province, but COVID-19 is now all around us. More than 90% of the COVID-19 cases in New Brunswick are travel-related. If you don't follow the rules, if you don't self-isolate for 14 days as required, we could have surges of cases in January, and most likely will. Today's update serves as a reminder that the virus is still with us, and that given the opportunity, it will spread quickly. Now is not the time to get complacent. There is a light at the end of the tunnel, but we're not quite there yet. No matter what zone you are in, I urge you to continue to take precautions in the days ahead and follow the directives of public health. Working together, we can ensure that all New Brunswickers have a safe and healthy holiday season. Thank you. Merci.
Merci, Ministre Shepherd et Dr. Russell. Thank you, Dr. Russell and Minister Shepherd. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser vos questions dans la langue de votre choix. Chaque journaliste aura une question et un suivi. We'll now proceed with questions from members of the media. Each reporter will have one question and a follow-up question. You have the right to pose your question in the language of your choice. Voulez-vous assurer de désactiver le son de vos micros? Please ensure your microphones are placed on mute. Travis Fortnum, Global TV.
Hi, my question might be best posed to Dr. Russell. Of the at least 24 staff at the Edmonton Regional Hospital who are self-isolating, I'm wondering if you can tell us how many of those are healthcare workers.
My understanding is the people who are self-isolating at the moment are healthcare workers. I don't have any further details on that.
Mr. Fortnum, do you have a follow-up today?
Yep. So is the province moving any healthcare workers from elsewhere in the province to help at that hospital, or?
I can answer that.
I can let you know that Vitalite has been moving resources around from the hospitals in the northern region, and they have been addressing this since this morning.
Thank you, Mr. Fortnum. Thank you, Doctor. Thank you, Mr. Shepherd. Laura Brown, CTV.
Hi there, Dr. Russell. I'm wondering if you have sort of made any connection with the source of this outbreak. And by that I mean before in interviews you have said you felt confident that despite things were still under investigation, you felt confident it was still going to be connected to travel. I'm wondering if you fear community transmission in these cases.
No, not at all. Thank goodness. Our teams have been working really closely with respect to the cases and contact tracing. What's happened with this particular zone is there are 2 clusters, and each cluster is traced back to travel.
Thank you, Dr. Ms. Brown. Do you have a follow-up?
Can you tell us the status of the others that are in hospital at this time?
Well, all I can tell you is that there are people in intensive care, and obviously that's very serious, so we'll have to wait and see in terms of how things continue to go, but just keep them in your thoughts and prayers.
Thank you, Ms. Brown. Thank you, Doctor. Jean-Philippe Hugues, Radio-Canada.
Oui, bonjour.
Hello. In the new cases in Zone 4, of those cases, how many are healthcare professionals?
Allô?
Hi, Jean-Philippe. We do have this information, but I don't have it in front of me right now. Let me double check. There was a group of active cases that were healthcare workers and another group that were patients, but I don't think I have the total numbers close by. I can give them to Bruce after this if you'd like to get in touch with him. Yes, I would, but are all the cases in Zone 4 patients and healthcare workers? Well, no, because for the time being, all I can say is that generally, yes. But I do know that a school was affected, but I don't know if it's because of a close contact or simply a case. I know that a daycare was affected and also a school, but I don't know if it was because of a case or a close contact. For the time being, I do think it's a close contact, but I will confirm all this information and Bruce will pass it on to you. I have a follow-up. The New Brunswick Nurses Union published a brief where they said that it was disappointing to see that we didn't learn from the first wave in terms of protecting nursing staff. I'd like to know what has changed, what hasn't, regarding the work that healthcare workers do and how we protect them from COVID-19. Are you talking about the vaccines? No, I mean protecting them so they don't get infected. For instance, at the Edmundston Hospital, the union said that we didn't learn from the first wave. What do you have to say about that? I don't understand the question. I don't think I can hear you very well. Let me repeat, I'm sorry. The New Brunswick Nurses Union is disappointed that lessons have not been learned from the first wave. Nothing has been learned. Things have not changed regarding nursing staff safety, hospital staff. Do you agree that things haven't changed between the first and second wave? No, I don't agree. I do not agree at all with that. I know that in both authorities, there was a lot of work with nursing staff and all healthcare professionals. There was updating of the protocols as well. And even in Edmundston, from the information I have, I do believe that they have just done a refresher, as they say in English, for healthcare workers in the hospital. So they just did a refresher class to remind them how to apply all the protocols to fight this infection. Thank you, Mr. Hugh. Vicky Hogarth, Charlotte County TV.
My question is for Dr. Russell. Dr. Russell, we know that the vaccine protects against symptomatic COVID-19, but do we know yet if the vaccine prevents transmission entirely? Can a vaccinated person still potentially spread COVID-19 to other people?
So the jury's still out on that, so that's why while we undergo the rolling out of the vaccination program, we will be getting more information as more people are vaccinated, and we can see some of the surveillance data on that. So it's not known yet exactly what kind of protection people will have, and so until we get more information, then we'll have to just continue to vaccinate people and assume that there is still a risk, and we'll still be asking everyone to follow the same public health protocols and measures.
Ms. Hogarth, do you have a follow-up?
I do. It's just a quick one. I'm just wondering if the first person to get the vaccine in New Brunswick has been chosen.
No, not yet.
Thank you.
Thank you, Ms. Hogarth. Tom Bateman, Times and Transcript.
Hi there. I think this is for Dr. Russell. I just wonder if the prospect of Zone 4 celebrating Christmas in the yellow phase of COVID protocol is now out of question now that we're exactly 2 weeks away from Christmas.
Well, I won't never say never. We have to follow along and see what happens. I think if everybody digs deep and we go hard at trying to contain this really, really quickly, then I think all we can do is do our best at this point in time and see how things go. But obviously, with all of the other outbreaks we've had, for the most part, it has taken 2 weeks, but in some cases it was less, some cases it was more. So we're just going to have to do everything we can with all of the resources we have and the cooperation and of our citizens and everybody in those communities to pull together, and we'll see what we can do all together.
Thank you, Doctor. Mr. Bateman, do you have a follow-up today?
Yes, thank you again to the doctor. Exactly what new evidence became available to you and your staff to inform the change in guidance on masks? I think, the indoor-outdoor or the outdoor wearing of masks is one of the more confusing things for lots of people. So what's made this change happen?
So you're talking about outdoor spaces in the orange phase and masks? Compliance.
Yeah, or what informed the change that you announced today?
I'm going to let Minister Shepherd reply.
Great.
So I think I can address that by saying compliance. It became, early on, before we had mandatory masks, it was very difficult to get people to understand the importance of masks and to have high compliance rates. Now we have extremely high compliance rates, and people understand the importance not only of masking, but of that 6-foot distance and of the precautions that they need to take at all times, hand washing, that kind of thing. So as the public has become more helpful in us keeping this at bay, we have been able to see that some restrictions just are not necessary. And so at the beginning, when we were seeing people congregating in parks and it was an outdoor place and it was nice and safe feeling for them, they didn't mask. And so that was why we went to mandatory masks, because we needed that compliance effort to be much higher. We have that now, and people are really very used to wearing their masks. So now in outdoor spaces, they know if they're walking their dog in the park, we're not expecting them to have a mask on unless they're going to stop and talk with people along the way. If you can't maintain 6 feet, we want you to wear a mask. But we think now people are understanding, after all of our months of going through this, are understanding how helpful they can be by doing this.
Thank you, Minister. Thank you, Mr. Bateman. Bobby Jean McKinnon, CBC.
Yes, thank you. Dr. Russell, based on the number of healthcare workers involved and the fact that this outbreak is at the hospital, what are your projections telling you at this point? How bad could this get?
Well, our assessment team is made up of representatives from Vitalité and Horizon, and so when they're looking at their staff in terms of who has to be off because of either being infected or because they're self-isolated, they are the ones that are looking at the resources at this point in time. From a public health perspective, we were concerned about the capacity, and so they were informing us of the impacts that the staff was having in terms of how they can operate the ICU, et cetera, and have admissions and the emergency department. So as of right now, all the staff and the patients are going to be repeatedly tested, just like any of the outbreaks that we've seen in long-term care facilities. So that's going to be going on for the next several days. So every couple of days they'll be tested, and we'll keep an eye on that. But certainly it has impacted their capacity, which was one of the triggers for going to orange. And obviously being able to manage this quickly will obviously have a positive impact, hopefully, in terms of turning things around sooner rather than later.
Thank you, Dr. Ms. McKinnon. Do you have a follow-up today? Ms. McKinnon?
Sorry, I was still on mute.
That's allowed.
Yes, getting back to vaccines. We know 1,950 people from the priority groups outlined yesterday will be the first to get the vaccine, and we know that they have to be able to travel to the Miramichi Hospital to get the vaccine because of its cold storage demands. But beyond that, Dr. Russell or Minister Shepherd, could you please explain how those individuals will be selected? Will it be, for example, through a random draw or of Medicare numbers?
So I can share with you that because this 1,950 vaccine doses will be limited to an area, we have carefully calculated the numbers of those who are in the nursing home and the employees that work there. And we know that they're going to take up approximately, I think it's approximately like 40 to 45% of the doses that are available. And then, of course, we'll go on to the other sectors. So it's, we've been talking with Shanax. They're very cooperative, and they are going to make arrangements for anyone who is able to come to the hospital, to the clinic, to receive their vaccinations.
Thank you, Ms. McKinnon. Gilles Duval, CMT.
Oui, bonjour.
Hello. My question is for Dr. Russell. I think earlier on we talked about patient 0 here for the second wave. I think it was linked to a travel. Have we been able to determine if that person did self-isolate? And if they stop seeing their friends and family, or have all these people continued to move around their community and propagate the virus? So the outbreak has 2 index cases, 2 parts. So each part of the outbreak in Zone 4 is related to travel, but for confidentiality reasons, I cannot talk about other details. It is still under investigation for the moment. And so I will not give more details, but I can say that there is no community transmission. It is travel related. Do you have a follow-up question for us? Yes. We kind of heard that there would be 2 schools with cases here, an Anglophone school and a Francophone school. Do you have that information, or hasn't it come in yet regarding schools? The most up-to-date information that I had was that there was 1 school that was affected and potentially a daycare. But I haven't heard about another school. Thank you.
See Dr. Jordan Gill, CBC.
Yes, I guess this is for either Dr. Russell or Mr. Shepherd. The boundaries of the St. John and Fredericton regions were recently changed. Are any changes being considered for the Edmonton region, even if only temporarily, to allow those who live far away from the center of the outbreak to celebrate the holidays with their family and friends?
So public safety has been working with public health on trying to identify communities of interest so that we can, minimize but stay within safety regions. There was already a change in the Edmonton region with Keswick and Saint-Quentin, I believe, and so they are now in Zone 4. They will remain in Zone 4. Outlying areas still get their services from the more urban areas, and it is important that we're all in this together. So if Zone 4 is under orange, then everyone included in Zone 4 will be orange as well, unless we have determined to make changes on the map. And public safety will actually be updating government on that in the days coming.
Thank you. Mr. Gill, do you have a follow-up?
Yes, I do, and this is also for Mr. Shepherd. What was your role in the Atholville Special Care Home deal that exempted it from following the staff ratios set out in provincial regulations? Did you sign off on it, and what provisions were there to check in over the course of that year-long pilot?
So I don't have all of the information here with me today, but I will tell you that I was Minister of Social Development when that pilot project began. It actually started under the previous government, but we all have a role to play in our positions that we do. We are a government who has always said that we would be very proactive in trying to address our staff shortages. But this was about innovation. This was about a company who felt that technology could help in a special care home where clinical services are not necessary. And so that was my role. I was Minister of the Day.
Thank you, Mr. Gill. Thank you, Minister Shepherd. Sarah Seeley, Times and Transcript.
My question is for Dr. Russell. I was wondering if there was a significant number of asymptomatic carriers with the Zone 4 outbreak.
So I don't have the breakdown in terms of the test results right now that were from asymptomatic or symptomatic people, but I do know that, in every outbreak, there are people who are pre-symptomatic and asymptomatic, especially in younger populations. So, but I don't have a breakdown in this particular case. But certainly the transmission of COVID in a community is very serious, and so we don't have community transmission at this point, but the quicker that we get this under control by having gone to orange, the better.
Ms. Seeley, do you have a follow-up?
Yes, it's also for Dr. Russell. I was wondering if, given the number of cases in the hospital, if additional safety measures beyond what's already in place might be required.
My understanding is that Vitalite is working with public health and the IPC folks to make sure that everything that needs to be done is being done. So I know that Vitalite has offered testing for asymptomatic employees over the next 3 days. And separate from that, they've changed what services they're able to offer right now. They've changed their visitation with respect to only allowing people to visit for pregnancy, palliative, and pediatrics, I believe, and they're recommending that you don't go to the emergency department unless you have a very, very urgent medical problem.
Thank you, Ms. Seeley. Thank you, Doctor. That concludes today's update. Thank you very much. Voilà la fin de nos mises à jour. Merci beaucoup et bon week-end.